Are you a person with diabetes and you've been told that you can't eat oranges because it will spike your blood sugar? Or maybe you're pregnant and you're concerned that if you eat oranges, you could develop gestational diabetes. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist, board certified pediatrician, and a certified nutrition specialist. What I'm not is a dietitian or a nutritionist. I want to tell you what I found when I researched this because I am a medical researcher and the author of several medical textbook chapters, which I've written with one of my colleagues. So I'm doing an orange challenge where we eat 1 or 2 oranges a day during the month of September. If you haven't joined it, go to my website or I'll put the link below. Sign up. And if you love oranges, you're probably going to enjoy this challenge. We're going to be meeting about once a week to learn interesting facts like people with diabetes can eat oranges and why you should be eating oranges. We're also going to get emails to keep you up to date with the things that I'm finding, to give you some resources so you can remember the things that you're learning, and we'll share some recipes. If you submit your recipes and you participate, you'll be entered to win a prize. And we got some pretty good prizes, at least in my opinion. So if you haven't signed up, the link will be below. Join me. And if you haven't subscribed to this channel, I hope you will. I'd love to have you. If I say something that I like, that you like, be sure to hit the like button and then share it with someone that you think could use this information. So first, let's start with what is diabetes? Diabetes is a condition where your body either isn't making enough insulin or the insulin that's being produced isn't effective enough, so that you end up with high blood sugar levels. And this is not good for us because the high blood sugar will bind to proteins in our body and cause what's called glycation end products. These are very damaging to our cells. They cause chronic illnesses and premature aging. When you eat an orange, you are going to be taking a step toward bringing down the inflammation and the buildup of things that cause chronic diseases. So when you are thinking about what you want to eat on your diet, it's good to talk with a dietitian or a person who's a dietitian to get some specifics so that you can learn things like carbohydrate exchange and which fruits are better for you to eat and the ones that you should avoid. Some of the ones that I have read that you should avoid are pineapple and watermelon, mango, and papaya. But even those fruits could probably be eaten in small amounts over a period of time. For example, if you have diabetes or concerns about your blood sugar being elevated, instead of having a large piece of watermelon, you may need to have a smaller piece and enjoy several servings throughout the day, or maybe 2 in a day, and check your blood sugar level to see if your blood sugar is spiking. You can also do things like carbohydrate exchange. If you know you want to have an orange, because that's what we're doing with the challenge, then you may want to cut out some of those other carbohydrates that you may be usually having with your meal. For example, if you like a slice of bread that's high in carbohydrates, you may need to cut back on bread or cereal for breakfast if you want to have an orange. You get the picture. But a dietitian is the person that you really need to be working with. I'm not giving you medical advice. I'm referring you to your health provider so you can get the personalized care that you deserve. But it is a misconception, according to the American Diabetic Association and the Diabetes Council, that people with diabetes cannot eat oranges. Those two organizations say that you can eat oranges, but there are some guidelines. It's also noted that oranges are actually something that you would benefit from if you have a condition like diabetes, because diabetes causes increased oxidative stress due to that high blood sugar. And the oxidative stress can be addressed by things like vitamin C. Vitamin C is very available in citrus fruits, including oranges. When you have your vitamin C, you're going to get 92%. I'm sorry, when you have an orange, you're going to get 92% of your daily recommended amount of vitamin C. That's a medium-sized orange. Something about like this. The other thing about having an orange and why you may want to have it is a lot of those long-term complications of diabetes appear to be reduced, the risk is reduced by consuming oranges. And here's why. Oranges are a low glycemic fruit that has high fiber for the size, about 4 grams of fiber in here. And when you eat an orange, it's going to have the effect of a low or slow rise in your blood sugar level because of the fiber. When you drink an orange juice, that's considered high glycemic index because it spikes your blood sugar very high. And that's what the glycemic index is, a measure of how high or rapidly your blood glucose level increases after eating certain things. Some people think that it's not the best measure, but we're not going to go into that on this video. So when you have your fiber, what has been shown in the studies is that people with type 2 diabetes, the fiber in an orange can help lower your blood sugar level and give you a better hemoglobin A1C level. Oranges have lots of vitamins and minerals, and this is particularly important to people with diabetes because some research suggests that people with diabetes need a higher vitamin C level because of the oxidative stress. Now, if you're taking vitamin C supplements, you must be aware that your body can only absorb so much vitamin C at one time. The other thing is the vitamin won't have all the antioxidants that are in this orange. Things like flavonoids and carotenoids, these are antioxidants that have been shown to decrease the risk of heart disease as well as cancers, cataracts, Alzheimer's, all the things that seem to have a slightly higher incidence in people with diabetes. In addition to the vitamin C, you're going to find that an orange can help you absorb iron. Iron is very essential for well-functioning red blood cells, which carry our oxygen. Iron will help the red blood cell carry more oxygen. Without it, you would have iron deficiency anemia, which would also disturb your sleep. People with iron deficiency anemia don't sleep well. It has the folate, and folate can help lower your risk for eye diseases that are associated with diabetes, as well as it can lower your insulin level and improve your insulin sensitivity. Oranges also have potassium. Now, it's going to give you 6% of your daily recommended amount of potassium. So you're not going to get enough potassium from eating one orange to meet your daily requirement for potassium. But the potassium in this orange is thought to help decrease the risk of heart disease. And low potassium levels increase insulin resistance. Some of those antioxidants, there's hundreds of flavonoids, but the flavonoids are an antioxidant that's going to help you with inflammation. Inflammation is something that researchers are linking to many of the diseases that we classify as chronic diseases or chronic diseases of aging. Things like diabetes, hypertension, cancer, kidney disease, stroke, heart attacks. We already talked about how oranges can reduce oxidative stress that's coming from the vitamin C as well as from the flavonoids. And we have other subclasses of flavonoids that are found in oranges that give additional protection from inflammation and heart disease. The people eating oranges is not something that's contraindicated, maybe in the past, but the new research is showing that people with diabetes can eat oranges, but you have to eat them in moderation and monitor your blood sugar, do carbohydrate exchanges, and pair it up with something that will help your blood sugar level rise a little slower. For example, nuts for vegetarians or non-vegetarians, or you might want to add some lean protein. I think the benefits of an orange are so healthy for us, especially the cardiovascular effects, that we need to eat more of these oranges. It's affordable, especially during the winter months, and that is something that a lot of people need, especially now. It's so expensive to get food and buy your vitamins and supplements and your prescription medications. Now, I'm not telling you don't take your prescription medications. I'm just suggesting that having an orange may help you with that high blood pressure and decrease your risk for some of the other conditions that you may be dealing with. So if you're interested in joining the Orange Challenge, September 1st through the 30th, we'll be starting soon. Find the link below. If you want to learn more about diabetes and eating oranges, go to my website and read my blog. And if you like this content and you want to learn more about the things that I'm doing in the area of sleep and wellness, subscribe to my channel. I'd love to have you. And don't forget to give me a like. That's it for now. And I hope to see you in the challenge.